person, but those are some questions you can use for that. Alright. Perfect. You guys are gonna get aphasia. You definitely need to know the difference between a Broca and a Wernicke's aphasia. You just need to understand it. You know, the biggest thing that I always remember is, can they comprehend language? So that's why you give them a three-step command is, actually, can they comprehend vocal language? That's how I remember the two. All right, cranial nerves. You've learned them before, right? Well, we need to test them, and you've already actually tested some of them. But when you do a screening test, we tend not to test cranial nerve 1. What does cranial nerve 1 test? Smell. But if you're doing a full neuro exam, you definitely want to do that. You also want to do it if someone has a nasal fracture. Okay? You want to make sure those nerves are intact. So a good way to do it is get 2 different smells. I recommend cinnamon and coffee because they're distinct smells. And you need 2 smells because you have to test both sides, right? So what you're going to do is have them close their eyes and plug one nostril and then open a container and let them smell it. So I've got the containers. Usually if you're in a clinic, they'll have these, or you can actually prepare them to make sure that the cranial nerve 1 is intact. And just open it up and let them smell it. So here's coffee. I couldn't find any cinnamon. So this is cocoa, because most people know cocoa. But it's a little hard to identify. A lot of times they'll say vanilla. So cinnamon is a real distinct smell. Don't stick it like in their nose, because they'll suck it up. But that's how you test for it. So have them close their eyes. Because, why do you want them to close their eyes? Because they can see it. It's coffee. So you will bias them on that test. So, cranial nerve 2 and 3 and 4 and 6. We actually do when we do our eye exam. So when we do cranial nerve 2, that's our optic nerve, right? So we want to look at the nerve itself. So that's why you do a fundoscopic exam. We want to make sure there's no swelling. You check a visual acuity, right? We want to make sure there's no lesion back there. So one of the things we do is a visual field test. And we know there's other reasons why they have a visual field defect, but we want to make sure there's no lesion. So you do a visual field. And also, you can have a pupillary problem with a lesion of 2. So it takes 2 and 3 to get your pupils to move, right? The ciliary muscle and the nerve of 2. So extraocular movement is how we check 3, 4, 5. It's a motor, right? 3 is our pupillary response. So indirect or consensual and direct. You want to check for size equality in the pupils. Cranial nerve 3 does the eye move upward. When we have them, is there any lid problem? Right? It does a couple of things. It checks cranial nerve, but it also, we can screen for hyperthyroidism. Eye moves down and in, cranial nerve 4. Cranial nerve 6, lateral. Trigeminal nerve. So cranial nerve 5, you will test this. You can test them all at once, or when you do the eye exam, you've checked your cranial nerve, those that have to do with the eye. So cranial nerve cranial nerve 5. It is facial sensation, that's the big one you'll test. And also, you check the jaw, and you have bite down. You're looking for any weakness of the masseter muscles, right? So when you have them bite down, masseter muscle and the temporal, but the masseter muscle is the test for cranial nerve 5. On your sheet, it's temporal, right masseter. I forgot to correct that. So it should be here. So when you go over your neuro exam, you've already checked the jaw. The motor of that nerve is when you check the jaw. So I want you to check sensation in the neuro exam. And what you're going to do is you're going to do what's something called light touch. And light touch can be accomplished by your finger, or you can use a Q-tip. Most people use their fingers, just easier. So, I want to just kind of pull this out a little bit. So light touch on the skin is just light touch, right? I can do that with my finger. So light touch. And you want to check the 3 branches, and is it equal bilateral? So you have the patient close their eyes, and you can say, do you feel me touching? No. Do you feel me touching? Yes. Does it feel equal on both sides? Yes. That's light touch. You want to make sure, though, you check all branches. Do you feel me touching? Yes. And here, and here. Do that on all 3 of those branches. Okay? And make sure it's intact. If it's not intact, you can check sharp and dull, but you don't have to do that with an SP. Sharp and dull, the best way to do that. So light touch is light touch. It's a different track versus sharp and dull. Okay? So don't get it confused. When we talk about pain perception, that's sharp and dull. And the best way to see if that is intact is to use a pin. So sharp this is sharp. And the back of this,
Is it clean?
right? No, I've used this too.
Thank you.
And this is dull. Right? So the back of that is a dull sensation, and then this is sharp. I don't have to push the needle through the skin. She knows it's sharp, she can feel that. But your pin is a great way to test for sharp and dull. And you will definitely do this when we talk about sensory on the body. But here, all you're going to have to do is do they have light touch intact? If it's not, then go ahead and check sharp and dull in those branches. Okay? So that's 5. Is it intact? Well, you tested for it. You can also check corneal reflex. We're not having you do that on SP, but remember that's part of 5. Cranial nerve 7. Okay? This is the one you check, especially if someone comes in thinking they're having a stroke, right? This is the Bell's palsy. So what you're going to do is definitely observe, because it's easy to see. But you want to have them smile, raise their eyebrows, close their eyes, because remember they can't keep that eyelid closed. So you want to have them close their eyes and actually kind of feel the muscle. So actually, close your eyes tight, don't let me open your eyes. And you can actually kind of try to pull those lids, and you'll definitely feel a weakness of the lid. Puff out your cheeks, frown, show your teeth, because they won't be able to raise that lip very well. And if we don't use taste, we don't test for it, unless you're working for a neurologist, but you can test both sides of the tongue with salt, sugar, which should be intact. but you don't use that. It's not on your sheet. You guys can watch this on your own. You can go through it. Bell's palsy is great. The guy that, the test is really great that they do on the patient. You can really see that Bell's palsy. Remember, what happens in the forehead in a Bell's palsy?
It doesn't move.
It droops, right? Okay. Cranial nerve 8. You've done this with the ear exam, right? Can you hear? So your finger rub? And it's also checking the Weber and the Rene, checking the vestibular apparatus, checking your auditory. So it's auditory, vestibular. Cranial nerve 9 and 10. It's looking in the mouth and having them say ah, because you're looking at the uvula. Does it raise equally? Okay. And we don't have our SPs gag. Don't gag them, please. Okay. So cranial nerve 9. Have them say ah. All right, so 10. Okay, accessory. So what you want to do is have them shrug their shoulders. Okay, and then you're going to put your hands, so shrug your shoulders, don't push down. You're checking muscle there. You're going to check their sternocleidomastoid muscle, so have them turn your here and push into me. Okay, you're going to see if both of those are equal. Your spinal accessory muscle. Okay, and the hypoglossal, again, we talked about that. You want to stick, you've seen this before with anatomy, stick their tongue out. You did this with the mouth exam. Stick their tongue out, move it side to side. Okay, you can actually check strength if you're not sure, because actually a tongue, that lesion is hard to see. When they stick their tongue out, it just barely deviates, but you can check the strength. Just have them put their tongue their cheek and you can push. Take the other side, you can check the strength. So that's your cranial nerves. Okay? We document, usually screening is cranial nerves 2 through 12 intact. We usually don't use mouth, but you can. You know how to do it now. All right, so let's go through the cranial nerves. I have the ophthalmoscope. Okay, since you guys are so good at it, as by my group that I graded, you guys need to practice. You should be able to see the back of the eye right now. You should be able to see the cup and the disc at this point. If you can't, you need to start practicing. You're going to be seeing patients not too far off. And you might be in the ER, and you need to make sure you can pick up papilledema, right? Or if someone comes in with a headache in a family practice, or if anyone you see has a headache, you better make sure they don't have papilledema. So you gotta see the back of the eye. You gotta start practicing. Okay? So let's go through the cranial nerves. I want you to practice. I've got pins. Please do not stab each other. Jeez. I don't have any Band-Aids, so. But I want you to understand the sharp and dull. Keep it because we're going to use it for sensory on the body. Each group grab one. But go through each of the cranial nerves. Remember extraocular movement. If you want to, you can go for it. You're welcome to.
I'm gonna go get it. She was speaking. What? Yeah. It's a nice dress. Just a compliment. You just said
Can I smell some coffee?